Hi, my name is Gabby Lewis, and I am 23 years old with classical homocystinuria from Boston, Massachusetts. Growing up, I didn't know anyone else with HCU but my brother and I. There were no specific support for our condition, and we often sought community within the PKU organizations, despite the differences between the disorders. Growing up, all I wanted was someone like my brother and I to relate to look up to, and most importantly, to give us some hope due to the uncertainty we faced of what our future would look like. I always felt increasingly isolated from my peers due to the rarity of HCU. Explaining my diet was a repetitive, painstaking process and often pointless because kids just couldn't understand my situation. I found myself wanting a friend who just got what HCU was and respected my disease management tasks. I made many friends over the course of my young life. I joined teams, played sports, but I never once felt like any of them truly understood me. In 2018, I was invited to Rare Disease Week on Capitol Hill after winning the Rare Artist Award for my artwork entitled The Light in the Dark. This was my first experience being surrounded by rare disease individuals, all with a common goal of not only to spread awareness, but ultimately to make the future brighter for all. In that same year, I attended the first HCU Network America conference in Massachusetts. This was life-changing for me and truly altered the course of my path. I met some of my lifelong friends who are both parents, caregivers, and patients. Since then, I've attended 2 more conferences, one in Indiana and one in Colorado. Every time I meet new individuals with new stories, but we always can relate in a way that I've never experienced before joining HCU Network America. With the addition of the umbrella of Homocystinurias, I have met new families with new conditions, but we can still find common ground and have connections that are lifelong. Outside of these conferences, I mentor and speak with kids who have the Homocystinurias. We mail letters back and forth, FaceTime, Zoom, send gifts, and most importantly, we listen. Growing up with HCU is hard. Every phase of your life brings new struggles, and if I can be the guiding light for them or a big sister figure, I want to be there for them in any way they need me. Working with an advocacy has brought me so many opportunities. I have written research about global rare disease connection while meeting people around the world, attended a young adult leadership academy meeting young individuals across America with rare diseases, and now I work for HCU Network America, assisting them with their digital strategies to help reach more people in the community than ever before. When I was young, I only knew my brother with homocystinuria. Now I know not only a whole community of individuals with HCU, but hundreds of individuals with differing rare diseases. I have found the people that understand me. More than anything, I hope that being a voice for change can make the world a better place for those who live rare. I want the children to grow up, to have a brighter future, and to have someone to look up to. This community has given me so much hope that I want to give hope back to the community. Happy World Homocystinurias Day. We are rare and we are beautiful.